So after the records appointment and the consultation with the orthodontist, the next step is to place separators or spacers. So what are the separators? What are they used for? Hi, my name is Dr. Dave. I'm a board-certified orthodontist, and today we're going to be talking about separators or spacers. It's a very common step in the process of getting braces where after you've taken the records, you've done the consultation, the next step is to create some room or create some space for the back molars. So some orthodontists will use brackets that are bonded or glued directly to all the teeth. In that case, you may not need separators, but some orthodontists will still use bands or rings that are glued and they fit around the tooth like a ring. And in order to create some space for those bands, separators are placed first. So separators are small, round elastics that are stretched out and flossed between the back molars. And what they do is they just lightly push apart the teeth. They create a little tiny space, a little gap, so that when the orthodontist goes to fit the back molar band on, it's just much more comfortable. So the separator is usually left in place for about a week. And the reason for that is that's about the amount of time that's needed to actually open up that space. Yes, unfortunately, with separators will make your teeth a little sore. And everybody's a little bit different with this. I find a lot of patients tell me that the spacers are painful and it's kind of the worst part of the braces. And I have other patients that tell me that they hardly notice the spacers. So most people are somewhere in between. So some people will notice a little bit of an achiness, a little bit of soreness for a few days after the spacers are placed. Let me know in the comments below how your experience was with spacers if you had them. When the separator is placed, the assistant or the orthodontist will stretch out the spacer and they'll floss it between the back molar. And as they're going through that contact point, it may contact or may touch the gum tissue a little bit. And then you may notice a little bit of a pinch feeling, and that feeling will usually go away in about a minute or so. In a few hours after the separator is placed, so usually anywhere from 2 to 4 hours later, that's when the soreness will start to kick in. Talk to your orthodontist or doctor about what the best options are for the pain during those first couple of days. Usually an over-the-counter pain medication is all you really need to get through those first couple of days. So a couple of tips just to help get you through the spacers process. Avoid pulling them out. You want to have the separator in there for that full week if you can. Now sometimes they'll just fall out naturally when a little bit of space opens up, but you want to make sure that the separator is able to do its job. If the spacer stays in there, then we know that that space is going to be there when the braces are put on the following week. So I also want to avoid sticky candy, gum, caramels, Tootsie Rolls, because that can pull the spacers out prematurely. Another really good idea is to stick to softer foods that don't require as much chewing. It's just going to make it that much more comfortable if you're not constantly chewing on those back molars, especially in those first couple of days after you get the spacers. You also want to make sure that you brush and floss normally. You can avoid the area where the spacers were placed, so don't floss where the separators were put in, but everywhere else you can floss normally. Of course, brushing is really important. It's natural to get some irritation where the spacers are placed because food can build up in that area. So you want to make sure you brush it and keep it clean. Just try not to floss or pull out the separator. I hope this video helped answer some common questions that you might have about spacers and separators. Hit the like button and subscribe if you want to be notified of future videos as they come out. Thanks for watching, and I'll see you in the next video.